Hi, I'm Dr. Ben Dodd from Brisbane Upper GI Surgery. Thanks for joining me today, where we are going to talk about considering weight loss surgery. Now this is a very big consideration for most patients. It's a big life event, and as such we need to consider very carefully about why we're going to proceed with doing it. Modern weight loss surgery is extremely safe compared to 20 or 30 years ago. Minimal pain, very low risk of complications, and if we see it for what it is, it's an extremely good tool to get your life back on track and restore your quality of life and your life expectancy. So I suppose in doing this, I'm not here to waste your time. I want to see you get your weight all off and keep it off forever, so that you can have the benefits of a long, healthy life at a lean BMI. So let's consider why we should do weight loss surgery. We know that people who are significantly overweight, particularly over a BMI of over 35, with weight-related comorbidities, the list of which is endless, but any degree of metabolic syndrome or weight-related medical problem, then consideration should be given to weight loss surgery as part of the effort to get patients or empower patients to get back down to a BMI of 25. So we know that being overweight does very significantly affect your longevity. So that's the first reason to strongly consider it, is so that we can restore your life expectancy back to 85 to 90. But also, it's not just the improvement in life expectancy, but also the great improvement in quality of life. And people who become overweight, it doesn't just happen over a year. It happens very gradually and insidiously over many, many years, through subtle calorie excess day after day, year after year. And so poor old patients who find themselves overweight to that extent don't notice it happening. Once patients have had weight loss surgery, and even when they've only got 10 to 15 kilograms off, they really do consistently notice how much better they feel. They're sleeping better, they're moving more easily, the usual stiffness and soreness has resolved. They're far more functional and able to perform their activities of daily living easily and walk up hills and stairs much more readily. So it really does make patients feel better. So improvement in longevity, dramatic improvement in quality of life, and mobility and energy, and simple functionality in terms of trying to do your normal day-to-day life. But if addressed properly, I think many patients also feel quite frustrated with decreased self-worth and happiness as they become overweight. And so if we do this the right way, then this process of weight loss surgery really does make patients restore their sense of self-worth and happiness and control in terms of trying to exist as a lean, healthy person in our modern, very obesity-provoking food, or dysfunctional obesity-provoking food environment. Part of the process of becoming a lean person again is restoring your, as I say, BMI and longevity, and therefore quality of life, but also by going from being an overweight person over a BMI of 35, usually to becoming a lean person, is that you reverse or prevent what is otherwise going to be a very significant medicalisation of your life. And some young patients, even with high BMIs, manage to avoid this medicalisation of their lives. But certainly as they get older, invariably the underlying asymptomatic metabolic syndrome and weight-related medical problems invariably catch up with them, where they do end up developing diabetes or blood pressure problems, and therefore have their lives medicalised with having to attend doctor's appointments all the time. So part of the very significant benefit of the weight loss surgery journey is demedicalising your life so that you can live a happy life and avoid the logistics and pain and expense of having your life medicalised. So there's a lot to gain through becoming a lean person. Surgery is a fantastic tool to help you get there. If it's addressed or proceeded with patients' eyes wide open and they are properly informed and see this for what it is, weight loss surgery is a tool to help you address lifestyle factors, make subtle, sensible changes, particularly to eating, so that they may then get their weight down, not just part of the excess weight off, but getting it all off back down to a BMI of 25 or less, and then keeping it there forever. And if we do that, then it is probably the best healthcare intervention on planet Earth in terms of the return on investment for patients and for society more broadly. So hopefully this answers some of your questions. I look forward to meeting you in person, where I will happily answer any more, and I will look forward to getting you back down to healthy BMI so you can get all of the benefits that go with it. Thank you.